Sure. Okay. Well, for clarity purposes, the way a close contact is defined, it's not arbitrary. It's not something made up by the White House. It's CDC guidelines, and how they define it is being within 6 feet for a cumulative total of 15 minutes over a 24-hour period. That they were not. All of their interactions were publicly available. I think you saw them, and that's how that assessment is made. In terms of additional testing or anything along those lines, those assessments would be made by the president's doctor. He was tested last evening and tested negative. We have incredibly stringent protocols here at the White House that we keep in place to keep the president safe, to keep everybody safe. Those go over and above CDC guidelines, and that includes ensuring that anyone who is going to be around the president is tested. Every member of the staff is on a regular testing protocol. If you're going to see him in person, whether you're traveling with him or you're meeting in the Oval Office, you will be tested. We try to do socially distanced meetings when necessary. For those employees who test positive, they are required to isolate, of course, in alignment with CDC guidance, must test negative before returning to work. That is also a step that goes over and above. But we are going to continue to follow the protocols. And I would remind you and reiterate that we also put out a plan just a month ago that made clear that, well, COVID-19 will continue to be with us, and we will see cases rise and fall, as we are seeing them rise now, to be expected given the transmissibility of BA2. We now have steps to go back to many of our normal routines in alignment with what the CDC continues to recommend.